And he went away. All right. So first, I'm going to go ahead while Russell's trying to, one more time, get back on. Kristen, I'll go ahead and I'm going to go ahead and start with you just to give some opening statements here. Kristen, go ahead.
I was trying to pull up the numbers in lieu of him jumping off. Okay, so today's numbers, we have at Medical Center 73 COVID positives in-house. That will be 44 in our med-surg, 29 in our critical care unit. We did close to elective procedures, and so therefore we have overflowed into our Whitney Stewart Medical Pavilion for our critical care. When you break that down, we have 18 on 4 Central, 26 on 9 Central. We have 11 in our overflow, and we have 18 in our critical care unit on the inpatient side. 22 of those critical care patients are ventilated. Total for our vaccinated in-house, we have 61 that are unvaccinated, with those being throughout our critical care as well as some on our med-surg floor. And we have 10 that are vaccinated, with 2 of those being in critical care. Was Russell able to jump back on before I move over to staff?
Yes, I'm here. Sorry about that. Every time it told me it was being recorded, I clicked on it, it was kicking me off. So I do thank you, Kristen, for the update. Sorry about the technical difficulties. Trevor, I sent you a graph. Can you share that up there? Do you have that available?
Yes, let me pull that up.
This is a projection graph of what the next 10, 15, 20 days looks like in our region. And I wanted to share this just to get everybody an idea of what the experts are telling us, what we can prepare for. It's quite interesting what it says, but the numbers, here we go. If you will look on the far right-hand side there, you can see that the projection, the lines going up, and this is in our trauma service area. And there are several different theories here, but if you notice, most of the lines are on the left side of that green line. And this is just for our trauma service area J. And if you look at that line, it is saying that there will be, that's 500. Now, if you go to the one below it, the COVID-19, there would be 300 cases in the ICU in the Permian Basin, which is us. And that number is very alarming. These are projection graphs. Of course, things can change. We know that, but we do give a lot of thought, and we take these very seriously. But to look at that bottom one, it says COVID-19 ICU patients in the Midland Odessa area, trauma service area J. Those projection lines are really headed in the wrong direction. Those are pointed straight up, if you will. So if you think that we've got 70 or so in our ICU today, if you think about if you take us and Odessa Regional Midland together, there's probably 100, maybe 100, 140. But then you start thinking about doubling that by September in the next 15 or 20 days. So that would mean us going from 70 to 140 or 150 just right here at Medical Center. That is a very scary number. That is not what we were looking for at all. But this is just it is a projection, so we do monitor this daily. But this is hot off the press. This just was released today. This graph was so where we are making plans just to be prepared for this, things we've done, things we need to do. And so that is, I just wanted to share this with everybody so you could kind of see what we're looking at. I especially wanted to give Dr. Murray a firsthand look at this so he could kind of see what we're talking about. One other thing of note today, I did see that there is consideration for emergency approval of a third shot of Moderna or Pfizer. which it'll be interesting to see how quickly that moves through CDC and the FDA. But that has suddenly popped up as emergency use for a third dose or a booster shot, which should not surprise any of us. We've been talking about that for a couple months, but we will keep an eye on that as well, and what that would mean for our community. What would something like that look like? But at the same time, that's just now making its way to the top. So the projection is upward. Again, what we've said all along is wash your hands, wear your mask, educate yourself on the vaccine. I can tell you, I think Kristen told you, our unvaccinated in here is the majority of the people we have in the hospital. Our vaccinated people are very small part of the number. So does the vaccine cure it? No, it doesn't. Does it give you a better chance to survive? Yes, it does. And that's what we're talking about now, survival rating is how you survive this. So I'll send it back to Kristen, and you want to talk about the staffing, and then Trevor, that's it for me.
Sure. So today, just an update for everyone, we have 25 staff out. We have 19 out with COVID and 6 that are out on what we call cohabitation. That is those individuals living with someone with COVID and under our exposure algorithm must remain home. Last week, just to give you an idea, in 5 days, we tested 30 employees and 11 of them were positive, having been exposed outside of the organization. I think overall, you can tell that we have critical staffing, and I just want to kind of give you a bird's eye view while we're looking at projections, kind of where we are at currently. You can see in what I'm sharing now, you have your, is it showing for you, Trevor? I'm sorry.
Yes,
okay.
Everybody can see.
So this is what we are tracking here as our census level at Medical Center. And you can see the blue is our medical non-critical COVID units and how we've trended there, as well as the orange being our critical care. So if you look to the far right, you can see that towards the end of July, first part of August, where we sit currently, our critical care numbers and our overall projections are making their way very quickly up to the peak of where we were in November and December. And really the comparison I make for you is the simple fact that we had 100 FEMA nurses in our building at that point in time, when we were nearly where we are right now, and we have none in our building currently. So when we say we're at a crisis staffing level, I just wanted you to kind of see in a bird's eye view of why we're at a crisis staffing level, because we are experiencing such a high in volume of patients, and many of those turning to critical care very quickly. So overall, before COVID, we had 74 open positions. And so now you're on average, you're running 10, 13 short just in specific departments, whether that be a nurse or respiratory therapy. So it's very important that we continue reaching out to the state to talk through the staffing needs in our organizations and having the support of the community and other organizations to help us in that voice, just because we do need that staff here. I know that many of you listened to the presser that Russell did not too long ago in sharing with what our wage wars are from the contract non-FEMA travel agencies. And so we're really having a hard time bidding out those employees to come to the Odessa Midland area. And my last thing, Trevor, I just wanted to remind everybody on visitation. While Wheatley Stewart is closed, we are still allowing 1 visitor per patient under those guidelines of Governor Abbott. In the surgery area, when there is a patient having surgery, they can have 2. When the patient goes to a room, then of course it needs to drop down into 1. All of our waiting areas are closed. We are continuing our visitation for our COVID patients under proper PPE guidance. However, it's very limited because we do want to follow CDC in decreasing the amount of exposure time that these individuals have. So if they are not in critical care, they can come from 1 to 3 or 6 to 8. We're giving them small blocks of time within those hour increments, and then they will be pre-arranged so that we can properly meet them at the doors, escort them in, and put them in their PPE. For critical care patients, obviously, because they're undergoing many other types of treatments, their visitation for the COVID is only 1 to 3. We do not want to eliminate that time. We know how important it is for those families to sometimes spend the last minutes with their family members that are COVID positive. So we want to continue being very mindful of that. Just making sure that we're operating safely for them as well with PPE. When you come to our organization, please remember to bring your mask. You will be required to wear your mask at all times, or you will be asked to leave the building. We do this in not only in accordance to our compliance, but we really do want to make sure everyone is safe coming into the building. And that's all I have, Trevor.
Thank you so much, Kristen. Russell, appreciate that update from Medical Center. Let's go on to Odessa Regional now. And Stacy, I'm going to give it to you first.
Thank you, Trevor. At Odessa Regional today, we have 21 COVID patients in-house. 9 of those are in the ICU. We only have 1 on the ventilator, so that number's relatively manageable. I have a little bit of a breakdown of age too, because I think we're seeing on average much younger patients that are being admitted this time around than what we've seen historically. I only have the numbers for 19. I don't have updates for the last 2, but of the 19 that I received earlier in the day, 13 or 68% of them are below 60. And we're seeing patients that are in their their 20s. We even have an infant at Scenic Mountain today as well. Of the patients that we do have, the 21 in-house, 2 of those are from Big Spring, 1 from Midland, and 1 from Pecos. We have 9 employees out for either quarantine or self-isolation. At Scenic Mountain, we have 14 in-house today. 4 of those are in the ICU, also 1 there on a ventilator. And again, I mentioned those ages we're seeing the younger ages at Scenic Mountain as well. All the patients at Scenic Mountain are from that general area, and we have 16 employees out with COVID protocols in Big Spring. That's all I have, Trevor.
Thank you, Stacy. I'm going to kick it over to Dr. Sarah Vannon now.
Thanks, Trevor. I wanted to give a little bit more data on those graphs that you guys shared earlier as well. The important thing to notice on those graphs is that the line is now steeper and higher than in previous surges. So if it continues the way it does, it'll be worse than the previous 2 surges. Remember, we had 1 in July 2020 and 1 in October, November 2020. So this time around, it's rising faster and it's projecting steeper, which means it'll go higher and it may last longer. So it is something that we need to pay attention to. The fact that you have all of these leaders here on this press conference to make a statement to our community should tell you the weight of the situation and the importance that you should put on this and what you can do to get it better. Next thing I wanted to clarify is that booster shot, Russell, is specifically for immunocompromised people that they're discussing. They're not discussing it for the general population. So we don't want people who have gotten the 2 shots to think about that just yet. They're specifically looking at severely immunocompromised people for that 3rd shot or the booster. That only constitutes about 3% of the US's population right now. It may expand to everybody else, but as of right now, remember that the shots that we have works against this variant that we're seeing. That brings me to Delta. Very important to note that all the tests that we have sent out for speciating the type of variant that is causing this surge, the vast majority, 95+% of those tests are coming back as Delta variant. So Delta variant is what's causing this surge. You heard Stacy tell you there's younger and younger people being admitted. So we have to understand why. There's a difference between this surge and the last 2 surges. The last 2 surges, we had our prevention techniques for preventing the spread of the disease, but we did not have a vaccine. This surge, we have a vaccine in play, and this vaccine has been in play for 8 months. So if you look at our general population, talk about Ector County and Midland County, you have about 40%, 45% of the population over the age of 12 that is fully vaccinated. And you have about 75% of those that are over the age 65 fully vaccinated. So those people are less likely to get hospitalized, even if they do catch the disease. So first, it prevents some of the disease. Second, it prevents hospitalization if you were to get sick. That's why you're seeing younger and younger people being hospitalized. So disproportionately affecting the population that is currently unvaccinated. There's a lot of people on this call, so I don't want to take too much time, but I want to leave you with the morale of the healthcare community. And that's very important for us to understand what's going on. You have to understand that previously the healthcare community felt strongly about being there to take care of the patients in our community that had no other way to protect themselves. Now, this is almost voluntarily not allowing yourself to be protected. The morale in the healthcare community is going to be very different. There is a way you can prevent this. There is a vaccine available. The vaccine is widely available. Think about those healthcare providers that are now coming to take care of this surge in cases, knowing that you could have gotten vaccinated and you chose not to. So there is a difference in the morale in the healthcare community this time, and I think the community needs to understand that. Nobody wants to go through this again. The hospitals do not want this surge, do not want to take care of these many COVID patients. We are here for you if you need us, but we are hoping that you will do your part to make sure that this does not get to where it's projecting to get to. With that, I'll hand it back to you, Trevor.
Thank you so much, Dr. Saravanan. And I want to show the gallery view again to let the public know who is all here. So we've had MCH and RMC speak. We've got the city, we've got Odessa College, we've got ECISD, we've got UTPB on the calls. Up next, I know the mayor was here. Mayor Hoven, do you want to say a few words, sir?
Oh, Trevor, I'm here just to listen and gather information. I'll go ahead and pass it on to the next speaker.
Perfect. Let's go ahead and go to Dr. Murray with ECISD. I know they've had a really big week with school opening up. So thanks for taking the time to join us. And the floor is yours, sir.
Appreciate it. Thanks, Trevor, and good afternoon, everybody. Really, to spin off of what Dr. Saravanan said, we being the students and staff members of ECISD want to show gratitude and extend our deep appreciation for our medical community that we continue to partner with. We appreciate those relationships, whether it be providing collaboratively vaccinations for our community or just in seeking guidance and wisdom on how we effectively deal with this. We appreciate what's happening in our medical community and value the work that you're doing to keep all of us safe. And commitment that we make to our community is we want to be a part of the solution, and we are committed to encouraging safe behaviors within our own organization. And they start in the morning for us. We're asking all of our staff members as well as students to do a COVID-19 self-assessment every single morning. That's posted on the ECISD website. It is important that all of us gauge our own health, and moms and dads, please, we encourage you to do that for your child every day. And if you demonstrate any COVID symptoms, then home is the place for you. School is not the location. Work is not the location. The location is home. And so we encourage everybody to do a self-assessment. Bus riders, students getting on our buses in the morning, we provide hand sanitizer for all of our students as they get on the buses. Our buses are sanitized twice a day, and then we ride with the windows down to support a healthy airflow throughout that environment. Our schools are greeted, students and staff members every day are greeted with an opportunity to use hand sanitizer. If they come to school without a mask, we provide those at every entrance of the school. Our custodial staff is doing extra cleaning, especially of high touch areas throughout the day, morning, noon, and then after school hours. We are using a contact tracing protocol. Our nurses were very vocal in our providing contact tracing for all of our students. So if we do have a student or staff member that tests positive during the day, then we will contact trace and we notify all of our families. If your child has been exposed to the virus at school, we want to make that notification available. So ECISD is contact tracing. ECISD is also notifying parents of exposure. If a child or a staff member during the day displays symptoms of COVID-19, we do have a rapid test that we provide every campus and the administration building as well. We have COVID-19 rapid tests available. Our nurses utilize those with any of our students or staff members that display symptoms. Students do need to have parent permission for that to happen. And so moms and dads, you would be contacted before that assessment is done, again, by one of our nurses. The biggest thing that we are encouraging for all of our students and staff members are really two things. One, everyone that is medically eligible for the vaccine, we strongly encourage everyone, student or staff member, to become vaccinated. Again, we appreciate the support of our hospital, both hospitals, our entire healthcare community in providing those vaccination opportunities. We look forward to future opportunities to collaborate together to make it easy for both our students and staff members to get that vaccine. And the second thing is we are strongly recommended that everyone, every student and every staff member wears a mask at all times while we are indoors. Outdoors, different story, but the current recommendation is everyone, vaccinated or not vaccinated, wear a mask while inside. Again, that's all students and all staff members in ECISD. That is strongly recommended for everybody. Our numbers today, we currently have 24 employees out. This is, again, the third day of school. So we have 24 positive cases already and 12 students, again, on the third day of school. And so we anticipate that like the spiking as the graph displayed, we're hoping that our spike in our community won't be quite as aggressive, and we are doing everything legally allowed to do as an organization to make sure that our students and staff members are safe. That's it for me. Back to you, Trevor. Thank you.
Thank you, Dr. Geary. We appreciate you joining in this meeting so much, and your partnership here especially over the last 18 months. I'm going to go now to Dr. Woodley with UTPB. You have the floor, ma'am.
Thank you very much. The university is expecting to work very hard to have almost a normal fall for us. We expect to have in-person classes and events on the campus. We are also doing everything we can to make sure that we minimize the risk to our students of COVID-19. Our big push, of course, is on vaccinations. A big shout out to our hospital partners here who are helping us have vaccine clinics for our faculty and our staff and our students as they come back. We're encouraging our students to get tested before they come back and to wear a mask indoors and to social distance where possible. So all of these things we're working on to make sure that we have a smooth entry. We too are starting to see an increase in the number of cases among our faculty and staff. Most of our students are not yet on campus, and so we're watching that very closely to make sure that we can pivot at any point necessary to really ensure that we have a safe but wonderful fall for our community. So that's my report.
Thank you, Dr. Woodley. Appreciate you joining in here. And I believe Dr. Williams from Odessa College is here with us as well. Go ahead, sir. Floor is yours.
Hello, Trevor. Thank you for that. Good to see everyone on the call. My colleagues from the medical community and the education community. Thank you for your work. Those who have been in the middle of this battle for a long time, you are appreciated and highly valued. I stand with you, offer all of you my support. We at Odessa College do as well. Dr. Meary made some really good points, and I remind you that our fall will start on August 23rd when we welcome all of our students to campus, but we already have some students from ECISD on our campus, and we welcome them, and we want to maintain a safe environment for them. I think a couple of things that I can add at this point to the conversation is, much like Dr. Saravanan said, we don't want to weigh down our medical community. We want to limit the opportunities that they have to rescue us. They will be there, they will support us, they will stand up for us, but we need to minimize their load as much as possible. How do we do that? One thing is all who can get the vaccine. All of us who can become vaccinated and make sure that you're on top of those protocols. In addition to that, as often as we can, we all need to wear our masks when we're around people that we're not sure about, people we don't know what their vaccination status is, or other things. We need to protect ourselves. So education is so critical to our community, so critical. We are essential. We believe that, and our services and our work must go on. And in order for that work to go on, the number one thing we must do is protect ourselves and protect those around us. If we want our businesses to continue to thrive, if we want to be able to do the things that we love to do, we can make some slight adjustments in our behavior and allow those wonderful things to go on if we work together. So again, we stand together, we stand strong, we will get through this, but we need to be smart. We all need to make smart decisions. Thank you, Trevor.
Thank you, Dr. Williams, and we appreciate everyone who has joined in this. It's nice for the community to have all of the community leaders in one spot to hear from them. Now that everybody has had a chance to speak, I'm going to go ahead and open this up for media, and I'm going to go in no particular order, just the order that I have here on my participant list. So first one I see up is Mr. Danny Barrera. Go ahead, Danny. Do you have any questions, sir?
Yeah. Hey, Russell, those people that are the persons that are unvaccinated, how is that stressing out your resources? And what do you see in the future as rising health costs because of people not vaccinating?
Well, I think that the unvaccinated people in our hospital are requiring more care than the vaccinated people. I think that we're seeing that we're spending more resources, whether that's medicine, oxygen, personnel at the bedside, that an unvaccinated person is costing more than a vaccinated person, and it's taking more resources from the hospital. So it's very easy to spot a vaccinated person in here because they look pretty good. They don't feel good, but they look good. They're recovering faster, and they're surviving this. The unvaccinated folks are on the ventilator. They are just really struggling. It's almost an hour by hour situation with some of those folks. But I can tell you that it costs us more to care for an unvaccinated patient than it does a vaccinated patient.
That's all I have. Thank you.
All right, Danny. Thank you so much, Danny. Let's go ahead and get to the next one I see on my list, and that would be Mr. Francisco Soto from News West 9. Go ahead, sir.
I don't have a question for now.
All right. Thank you, Francisco.
Thank you.
All right. Up next is Mr. Mitch Borden, Marfa Public Radio. Go ahead, Mitch. Floor's yours.
Dr. Muri, are there any conversations going on about mandating masks at UCISD schools, especially as we see larger school districts across the state defy the governor's executive order?
There are conversations really across the state. In fact, even in the last few days, conversations about what is the right approach for us to take, not only as ECISD, but school districts across the state of Texas. I think local context is important. You know, there are communities such as ours that have a high rate of viral spread, and there are communities across the state of Texas that have a low amount. And so in Texas, we're looking for more local control and working with our state legislature to make that happen.
And yeah, have you heard from Brooks Landgraf at all, or like contact with other state legislators about potentially pushing for, mandating masks or allowing local, school districts and other organizations to mandate masks at all?
I have spoken with multiple legislators just about providing opportunities for local school boards to have local control so that we can make decisions, again, that are in the best interests of our school system. Yes.
And Dr. Sarah Vannon and Kristen, could you guys describe what things will look like on the ground in your respective hospitals if, the trends bear out that what UT is predicting, like what it could look like in the next few weeks, just like in your OR, not ORs, but in your hospitals?
So medical center, we're already prepping those spaces for those potential patients. We have continual conversations, and we're planning some as we continue to move forward on what do we do with the remainder of the elective surgeries that are coming through. How do we handle those? Where all could we pull staff from? We've already pulled from many areas that are non-patient facing for critical care. We'll be expanding that to other areas to include those that are non-critical care, but they are nurses. As a nurse, no matter where you go, you may not be able to do certain things because you've been off long enough, but you can help and you can give hands and you can give VAS and turn patients and feed patients. So you can run meds. So we're looking at all of those things. You know, Mitch, honestly, if it gets to the point that they're predicting, you very well could see tents, just because our buildings just don't have enough space to care for these patients, as well as those that are just normally sick and needing urgent procedures or that have been in car accidents. You know, as medical center serves as that trauma center, we get all of those kinds of patients from the region and we just can't take them without space. So you very well could see tents out in the parking lots if it becomes what they're projecting.
Yeah, Mitch, I think Kristen covered it really well. And the only thing I want to add to what you asked is how does it look on the ground? You've heard us use the word surge plans again and again. And that's what we're describing to you again is we're back at the table talking about surge planning, what to do if it gets above a certain threshold. And at each threshold, we activate the next level of surge planning. What it will look like on the ground, which is already looking like now, is patients who are in our ER that need a bed upstairs on the floor or in the ICU with no place to go, being held in the ER. So when we reported those numbers, when you heard MCH and ORMC report those numbers, you heard there was a certain proportion of patients in the ER that need a bed upstairs that there is no bed available. That's going to get worse. There's going to be people lining the hallways. There's going to be people in the ER lobby. There's going to be tents outside. There's going to be double and triple people in rooms because there's no other space to take care of them. And then we're going to run out of equipment again. And we're going to have those discussions we never wanted to have. Who gets what resource? Because the resources become limited. And that's a place we don't want to be.
And I guess my last question is like, you know, I think you just kind of described it, Dr. Saravanan, but like, is care having to be sacrificed at this point, and will it have to be sacrificed in the future if we continue on the track we're going?
No, it is not being sacrificed at this point. We are providing full care to every single patient. I think every hospital will confidently tell you that, but we will not be able to continue to tell you that confidently a couple of weeks from now, or maybe a month from now, if that projection is indeed true.
And that's the same for medical center. We are providing that care and we're doing our best to not get to the point of which we have to ration, triage, whatever term you want to put with it, the staff and the resources that we have.
The other thing to add to, Mitch, is what we're really trying to share today is that we can control this outcome. The process that we went through before to help control it is no different then than what it is today. If we'll wear our mask and if we'll try to social distance when you're indoors and around others and wash your hands, we can control this surge to prevent it from getting to the level that we saw on those projections. Those projections mean if things continue as they are today, because we don't have compliance in those measures and we don't have community members vaccinated that need to be vaccinated. And so that's what we're really trying to communicate to our community today, is that we hope you will stand up and do your part to help prevent our community getting to that stage that we saw in those projections, because we can make a difference.
Are y'all seeing any signs that interest is picking up in the vaccines and rates are going up, or is it kind of staying where it's been plateaued for a while at this point?
So if I can add a little bit to that question, Mitch, I think the difference now is when the vaccine first came out, we were starting to get a little bit of interest in people that were interested in listening to the science, understanding how the process works and why vaccines work in the first place. Now, those people have already been vaccinated. They have been for a while, which is why the demand went down. Now we're starting to see people coming to get vaccinated out of fear because they're seeing the unvaccinated people disproportionately being affected by this disease process. They're watching people die who are 30 years old. And those are people that are unvaccinated. So out of fear, we're seeing a little bit of a rise. It is not enough of a demand yet, but we're definitely seeing a little bit more interest in the vaccine now.
Well, thank you. Oh, sorry, Kristen.
If you want to know, I mean, our clinics are seeing, and I don't know about ORMC, but our clinics are seeing on average about 80 people a day for vaccines.
Perfect. Well, thank you all so much. And that's all I have.
Thank you, Mitch. Appreciate it. And then the one last media member I've got is Miss Ruth Campbell from the Odessa American. Go ahead, Ruth. Ruth, are you there? All right, she is not there.
I had to, sorry. Are any of the hospitals getting the medical personnel that Governor Abbott deployed? He announced something yesterday.
So medical center is in the process. We have made our request. We have answered all the questions, and then previous to his announcement yesterday, he had sent out 3 companies that will help us with rapid deployment. And so we are working with those individuals as well as waiting on a response from our border rack on those FEMA that are from outside of Texas.
Yeah, and it's the same at our hospitals as well, both here in Odessa and in Big Spring. We've made our requests, but we don't know yet how much of that request will be answered. There's also 2 more things to keep in mind. There's a limited number of staff available nationwide. And so if the governor says there's going to be 2,500 nurses coming in to help Texas, well, think about where they need to go. Think about the Permian Basin, but think about Austin and San Antonio and Dallas and Houston and the surges they're having. So we will see some. I'm hopeful, but we will not see our needs fully met. The second thing to keep in mind is we don't know if there is a cost associated with this. That is not something that we've been made aware of. We know that they're helping us get the staffing, but we don't know if it's going to be paid for or not.
Okay. And on the equipment end of things, how soon are you anticipating needing more personal protective equipment, oxygen, ventilators?
Ruth, with regard to PPE, I think there was a huge push to create a lot of PPE. I don't think we're going to be short PPE this time. We're going to have plenty of supply. But other equipment like ventilators and BiPAPs and oxygen, there will be sporadic periods where we'll have a lack of certain equipment, but we can move things around logistically around the country and make it happen. For example, tomorrow we're going to go, Odessa Regional and Scenic Mountain are going to be going and picking up a few more ventilators to make sure our supply doesn't run out. So as of right now, this surge, equipment is not going to be the biggest problem. Staffing is.
Yeah, Ruth, our situation is the same. Our PPE, our purchasing department has done great. We're well stocked and ready. The personnel is a problem, and our board did approve. Well, you heard the other day that we did order 40 new vents, and we're expecting those either tomorrow or early next week to be in house. So those are approved and on the way.
Was there any time frame for the personnel?
I didn't see any. Did you see any, Kristen?
No, not yet. We just heard, yeah, you put your lists together and get ready. We'll let you know as soon as things become available.
Anything else, Ruth?
Oh, thank you.
All right. I want to ask Kristen one more question, because the hardest part of this is for staff, and to go through something that they went through all of last year, only to make it through and think we got through it, and to have to go through an even worse situation this year. Tell people what it's like to be on the lines there. What is the morale like? The morale is, it's bad, and people need to understand.
Yeah, many of the staff will begin to tear up as you talk to them about what they're doing and what they're seeing. They've just been pushed way past the point of breaking, and they are committed to what they do, as well as the patients that they care for. That's what they went to school for. Whether you're a physician or you're nursing or respiratory, they're there to care for people. And so that's why they keep coming to work every day. But they also know that they just don't know how much they can take anymore. They're already stressed out, they're worried, their anxiety levels are high. I mean, quite honestly, their jobs stink right now. This is not what we went to school for. We went to school to care for people, heal them, and send them home. We didn't go to school to bury every fifth person that we laid in, our hands on. So I think that the morale across the board, and it's probably the same at every organization, is horrible. The staff, they want to do the best jobs that they can. They just don't know what else to do. And it's very hard for them to have to make resource changes and know that they're probably not providing the kind of care that they want to provide just because they're trying to make sure that they touch everyone in these staff shortages, that they have a bed for every person. Yesterday, when we moved our patients, it is a sight that if you were to walk the hall, you would never, ever forget. It's a war zone, and it's very scary, and it's mind-boggling. And even being in healthcare as long as some of us have, it's something that we never wanted to see, we never anticipated seeing, and it's haunting. And it's not something that these staff go home and forget about. They're just beyond breaking, and we need all hands in and all appreciation towards these individuals, or we may very well lose more than what we've already lost, and we can't afford to lose any more.
Kristen, you said something, I believe Dr. Sarah Vannon said something as well. It stuck with me, and I believe Stacy did as well, is this COVID-19 itself is not controllable. It will move on even if we have vaccines, but this situation we are in right now is controllable.
Right.
And I want people to listen to what you have to say about staff morale. We have less staff than we did last year when we have a bigger spike. And that's across the board. ORMC, our friends in Midland, they have less staff. The morale is even lower. When you're making these decisions regarding COVID and whether or not to get the vaccine, if you're still on the fence, if you don't get the vaccine, do the proper, wear a mask, keep yourself away from other people. Simple things. Do it for Kristen and her staff. Do it for Dr. Sarah Vannon and his staff, and Russell's staff, and Stacy's staff, and the staff at Midland Memorial, and these smaller regional hospitals. Do it for Dr. Muri, Dr. Woodley, and Dr. Williams, so they can better protect their students. Do it for these people who are working hard and going home to their families and wearing themselves out, taking care of people that have COVID. And we can control that. We can control this situation that we are in.
Yeah, you can have political battles all day long about whether you want it or you don't want it or what's right and what's wrong. But these staff are having their own battle of their will to come to work and do what's needed to be done. And that's the biggest thing right now.
Thank you guys so much for highlighting that. This is you won't believe me if I tell you it's a daily thing, that the sentiment on the floor is, oh no, not again. We don't want to do this again. I got an email this afternoon at 1:30 p.m. from our director of our community health center, Deborah, one of our superstars during this pandemic. She's gone out of her way to accommodate things. Here's what she said. She said, I want to reflect on what I'm hearing up on the floors. And there's 3 sentiments she wanted to reflect on. Feeling defeated. I thought we were winning, but now it's back with a vengeance. Feeling angry. We have tools to fight it, but there are several people in the community that are fighting against our tools. That she's specifically talking about masks and vaccines. Depressed. It's now affecting those that are too young to even get the vaccine. Those are victims in this fight against COVID. These are 3 things she put in that email just from half an hour ago before we started this. This is a daily battle for healthcare staff. So Trevor, Kristen, thank you for highlighting it.
And before we go, I thank everybody. I think we've got through all media and we're getting this message across. And I think it was very important for all of us to come together and update our community that we're not pulling any punches here. This situation is very dire. And we need to do now what we can to prevent this from spreading even further before we reach a point that we never thought we would ever see. And that's tents, that's people in hallways, that's several people in rooms. And we don't want to get to that point. And I think the best way we can end it is the way we used to end all of our press conferences. Russell, do you want to say a few words and lead us in a quick prayer before we go?
I'll be happy to. If you'll join me in a quick prayer, and then we'll get out of here. Let's pray. Lord above, we thank you for today, for our time together, Lord, and we thank you that you give us a community with people in it that can work together, Lord, and can get things done. And we thank you for just the opportunity to share today our concerns and our fears and our anxiety, and that we know that you are you're the great physician. You know the answer. You know how to fix this, and you know our hearts, and you know we want best for our patients, their families, and our families. Lord, we ask that you protect us, guide us, that you give us patience, that you give us protection, and that, Lord, you have your hand on every staff member fighting this battle every day, whether that's a doctor, a nurse, housekeeper, support staff, kitchen worker, whoever that is, that you protect them and protect our families, and you protect our community, and you protect the great state of Texas, Lord. We ask that you just give us some direction, give us rest and peace, and give us good communications with our families, Lord, and just let your light shine through us every day, and let us be the light in the darkness, and let us be the tip of the sword that you hold in your hand to slay this disease, Lord. And we just thank you for loving us and for sending your son for us. And it's in your name we pray. Amen.
Well, thank you everyone for joining us. We certainly appreciate it. You guys, everyone have a good day.
Thank you.